going to be having breakout groups, and we're going to be recording the first part of this session. And if that's not okay, if people are feeling very bothered by that, we can certainly, you can turn your screens off, but we hope you will participate. So here we are. Can everyone see what I want you to see? Thank you. Okay, great. So our learning objectives today, excuse me, sorry. We're going to describe effective agenda setting. We're going to reflect on why it's important, but for the most part, you're going to spend the time in small groups of 3 or 4, actually practicing agenda setting on 3 different cases. So what is agenda setting? Does anyone have a good definition of agenda setting, idea of what agenda setting is?
I like to think that it's essentially first gathering what the priorities of the visit are. So just what the patient's priorities are, what my priorities are, and then setting an agenda for that visit for what we mutually agree we are going to talk about so that we can meet expectations and kind of set expectations for the visit.
Great, awesome, perfect. Right, so you're working together to identify and align your priorities for a visit. And why is this important in an outpatient setting in a way that might be different than an inpatient setting?
Limited time.
Yeah.
Right, time. Our visits are time limited in clinic rather than sort of problem solution limited. In the inpatient setting, if you need to spend extra time with that patient, you spend extra time with that patient. If you need to go back and check on something, go back and try to talk about a different problem, you can do that. But in clinic, you know, ultimately you're going to have 20 to 30 minutes to address your patient's concerns and address your concerns. And that is a very intense and different skill. And it's not just limited to primary care. So for people who are going to be pulmonologists or cardiologists or nephrologists or rheumatologists or oncologists or any ologist other than a primary care doctor who also has a clinic, you're going to need to really get good at this because you are all such lovely, dazzling people. Your patients want to spend as much time with you as possible. And so learning how to kind of limit set in a way of what you're going to talk about is really important early on. And especially important now for these first few weeks, you're going to have fewer patients on your schedule. And that's really just to get you kind of up and running. But the temptation, I think, can be to spend way too much time with your patients because you have the time, and the visit will like expand to fill that space. So really try to challenge yourself to limit your visits to a half an hour. Because even if your visits are scheduled at like 1:30, 2:30, 3:30, that doesn't mean that it should be an hour-long visit. It means it should be a half an hour-long visit with like a half an hour in between to figure out all the mechanics of how to function in clinic that you might not understand yet. So to get help from your attendings or your chiefs on like how to put in orders or who to ask for help and things like that. So really try to like drill into your brain. These are 30-minute visits and you can get 2 or 3 things done each time. So agenda setting is super easy, right? I saw this graphic from the Journal of the American Board of Family Medicine. I thought it was actually kind of hilarious. Somebody had done like a process map of agenda setting. It seems way more complicated than it needs to be, but really, I guess if you dig down to it, these are all the different factors associated with agenda setting. So you will all memorize this for your test at the end of the day. So there's 3 main steps of agenda setting. First is initiation. The second is solicitation. And then the third, which is actually 4 steps, but prioritization and negotiation. So many patients will never have had someone do this with them, so don't expect that your patient knows the dance or the steps to the dance. They might not know the steps to this dance. So I think being really explicit and transparent is important, saying at the beginning of every visit, I like to lay out a plan for what we're going to cover during the visit to make sure that I'm not missing anything that's important to you. And really taking a few minutes at the beginning to be explicit about that. And then, solicitation is basically figuring out how do we get everything that's on the patient's mind out so that we can prioritize the things that are most important to them. We use the phrase what else instead of the phrase anything else or is that all? Why would we say what else instead of anything else or is that all?
It has a connotation that presumes that there is in fact something else rather than anything else. Has a connotation that like, oh, like, is there anything else I need to get out of here or kind of deal, or you don't have any other questions, right? Kind of already just coming in with a preset notion of what the answer is going to be.
Great, yeah. Anything else is a yes or no question, so it's easy for someone to say no when actually the answer is yes, but what else is not a yes or no question, so someone actually really has to like engage with the question before they can answer it. And so I think it's important to phrase it that way. And then one thing, sometimes it's hard to interrupt people who are not used to agenda setting in patients who are not used to agenda setting can really start diving into each topic as they get solicited. And so you have to learn how to artfully interrupt people so that they don't give you the entire HPI before they've told you what the second, third, and fourth things on their agenda are. So I usually say before we dive in to that, can we tell me what else is on your mind or what else you're hoping to talk about today? And then to reaffirm what you think they told you. So it sounds like X, Y, and Z or why you're here today. Is that right? And then you can also obviously bring your agenda into it. You can't cover everything usually, unless somebody's really just here for a sprained ankle and has nothing else, and that does happen sometimes, and you don't have any sort of chronic disease management stuff that you want to talk with them about, then the agenda setting is really straightforward. But often for wellness checks or for more chronic disease management, there's going to be a lot on the plate. And I use I wish statements when I know that I'm not going to answer everybody's problems. I wish we had unlimited time. I love spending time with you. I wish I had more time to talk with you today. And then you can propose an agenda. Obviously, you want to include what they thought was important and then a little bit of what you thought was important. Keep in mind that you have to like learn how to triage stuff in your mind of like life-threatening, limb-threatening, housing and job-threatening kind of situations up at the top, right? So something that might seem really important to you, for example, this patient's A1C is 13 and it's been 13 for 2 years and you are meeting them for the first time and like you really want to get on top of that because that's hugely important to you. But if the patient's like, I'm going to lose my job if I don't get this paperwork filled out today and the paperwork seems really boring, that's actually more important, right? Because that patient needs their job. If they don't have a job, then their diabetes control is certainly not going to get better. So thinking about how to triage things quickly in terms of like, is this going to kill this person today? Are they going to lose something important if we don't take care of this today? And likewise, this chronic disease, which has been a problem for years, if not decades, if we don't tackle it today, is it really going to change things between now and our next visit? Probably not. So, primary care is a marathon and not a sprint. So think about what needs to happen right now versus what needs to happen at some point in the future when you're doing your agenda setting. And then if someone's frustrated that you're not going to take care of the 18 things that they brought in on the list, just name that, right? It's super frustrating. You've been waiting for a long time. You're meeting me for the first time. We're having to start over. I get how that can feel really frustrating. And then you have a lot of clinic this month. So if you have unmet agenda items, you can always follow up with a phone call or a visit later on, or a telehealth visit over a video. And then you want to restate what the agenda is. Any questions about any of that? Does anyone have experience with this? All right, so a few more key points about agenda setting. Even though it feels like you're taking precious minutes out of your visit when you're doing this, it usually only takes a couple of minutes to do agenda setting. There are, of course, extreme examples of this taking longer, but the norm is that it takes a couple of minutes. And it really decreases the like bombs that can get dropped at the very end of the visit that can really derail things for you and for your patient. So the oh, by the way, or door handle questions, which are often things that are really important, maybe a little embarrassing, or maybe something that like the patient really just was reluctant to talk to you about for some reason because they're scared, but they then bring it up at the very end of the visit. Keep in mind that the first thing is not often the most important thing. Again, if someone is scared or embarrassed or anxious or whatever about the thing that's the most important thing, they might not bring it up first. Usually patients come in with 3 to 5 things they'd like to address, but you can't do that unless they are all like really, really simple, like I need medications refilled and can you look at this wart on my finger, and you know, things that are like very straightforward yes or no kind of questions. But complex decision making that we like to do in internal medicine, just anticipate that you can probably do 2 or 3 things in detail in a 30-minute visit. Great. Questions about that? Has anyone had opportunity to do agenda setting on any of their rotations so far, or in past life medical school?
I used to work as a PA and had to do it in primary care setting.
How'd it go for you, Kim?
It's hard to remember to do it. It's like an active thing that you have to do. And sometimes I would get lazy and forget. But I think like the times that I did do it, especially if I knew somebody was pretty complicated or typically had a lot of issues that they would always bring in, it was helpful.
Yeah, it really comes back to bite me in the backside every time I get lazy and don't do this. And it really is, it's a procedure. I think about it like informed consent or something where it's like there's a step to it. You want to make sure you're doing it the same way every time and like just get into the habit of like proceduralizing some of these things. And I have certain patients where I laugh every time I see them because I'm like, I will set an agenda with you and it will totally flame out, right? Like no matter what I do with agenda setting, I know that certain patients are always going to bring more stuff up, even though I have done everything I can to like elicit all of their concerns. And that's fine. That's just sort of the way things are. But for the most part, it's a very helpful procedure to go through at the beginning of every visit. So what we're going to do now is break into groups. And I don't know, Whitney, if you're sort of listening in with one ear. All right. Hi, everybody. I hope that went well for you. I wanted to take a few minutes to reflect on 3 questions. What did you see or hear or do that worked well? Question 2 is what was hard? And question 3 is what are you going to try to practice in the next couple of days? Let's see here. Gabby, who else was in your group?
I had Yuri and Marina.
All right, great. So Gabby and Yuri and Marina. Can you tell me what you saw, heard, or did that went well?
Yeah, so at least for the third case, so I was sort of the observer, and there was just like this laundry list of complaints. And I thought Marina did a really good job of sort of just going with the flow, but then kind of towards the end being like, okay, like, here are all your complaints, but, I think the important stuff that we should kind of stress about on this visit are, like your blood pressure and the alcohol, but then still kind of being able to be like, I hear you about all your other complaints. We should talk about that. But, again, I don't think it's the most important thing to talk about right now. So I thought that went really well.
Yeah, so I'm assuming then Gabby was the patient in that situation. How did it feel to hear Marina setting those limits with you?
Yeah, I thought she like did a good job of like addressing every point that I was trying to bring up. It wasn't like brushed off. It was like acknowledged and granted, like not everything could be done at the same visit. And so I felt that, she had a plan for like following through on them, even if we didn't talk about it now, that it would eventually be addressed.
Great. Marina, how did it feel to be the doctor in that situation?
It was overwhelming, honestly. There were a lot of different things that were brought up, and I felt like I was really trying to emphasize the important things. I do think I could have done a little bit of a better job in terms of like saying like, let's discuss like your alcohol use, because it was like something that was brought up, but really all the other complaints kind of took the forefront after that point. But I was also trying to make sure that like I'm acknowledging that there were other things that were bothering this patient, and making sure that we do have a plan for them at some point in the future.
Great. Thank you. And what was hard, or did anyone try anything that felt like it didn't work in your group and you had to like rewind or start over, or anything that you wish that you would do differently next time?
Yeah, I mean, I guess for me, I kind of started with sort of my agenda, and I think next time I'm going to try to stress sort of, hey, we've only got so much time to talk about this. What is super important to you? I have sort of my agenda that I want to talk about, but like, what is your agenda for this visit, and sort of be a little bit more, upfront about that.
Great. Yeah. So eliciting their agenda before you share yours.
Mhm.
But I think telling them up front, like, I'm sure you have things you want to talk with me about. I also have some things I want to talk with you about, but before I start, why don't you tell me what's on your mind, right? So make sure you get their agenda items first. Great. Anything else from your group? All right. Tam, who is in your group?
Lauren and Bree.
All right, Lauren, Bree, and Tam, why don't you tell me what did you hear, see, or do that worked well in this exercise?
I think Lauren mentioned something that she had heard on the lecture, like before we split up in groups, that using statements like, I wish we had more time to talk about this, is helpful to make the patient understand that I was not trying to be dismissive of the laundry list that they had, but also letting them know that I'm invested, I'm hearing that they have a lot of complaints, and then branching that off to, okay, here are the most important things that I think you want to talk about, balancing that with some of the things that I want to talk about, and, try to make that work.
Great. Yeah, I wish statements can be helpful anytime. I mean, when you're delivering bad news or when things aren't going the way your patient wants them to go. I think I wish statements can be really powerful. Great. What else?
I think something that I wanted to work on and that came across in like our role playing was sometimes I want to address the problems that come up really quickly, and as soon as the patient mentions like I'm stressed about this, like wanting to address that first. But I think taking a pause and making sure that I take a step back and kind of reframe everything, summarize what the agenda is before diving into all those problems is going to be really helpful in framing the whole conversation.
Yeah, great. Thanks for that. And I think patients often are used to getting interrupted pretty quickly, so they start talking really fast often, and will sort of elaborate on their first issue at length. And so the flip side of that skill is also sort of gently redirecting people back to agenda setting. Because we all want to solve problems for people, so as soon as you hear one, you're like, I know how to do this, like let me dive into this issue, but maybe didn't get like numbers 2, 3, 4, 5, which might have been more important to the patient ultimately. Great, thank you.
Yeah, and I think kind of like following on that, the one caveat we felt we were discussing with the third patient was like, he just might have not been a type of patient that you interrupt all that much, because he just had so many things he needed to get out there, and maybe even like just being listened to without being interrupted would be therapeutic for him in some ways, because he's probably so used to being dismissed and interrupted. So we were discussing like the pros and cons of that kind of a patient who has 11 things that they want to talk to you about. Just like allowing them, like recognizing that this appointment is like probably not going to be a particularly productive one, but also maybe like sacrificing that productivity for maybe some rapport building by letting them just sort of lay it all out there. But I don't know if you have like thoughts on whether or not that's a good approach for someone who just comes in like coming in hot.
Yeah, thanks, Lauren. Those are like a lot of really good points. So one higher level point that I think you're making here is the goal of your first visit with any patient should be to earn a second visit, right? I mean, unless someone's going to like die or lose a limb or something, like if you have created enough rapport that the patient wants to come back and see you, that was a successful visit, right? And you're right, the person who comes in with a list of like 18 things they want to talk about is probably the person who has been interrupted, cut off, disregarded, dismissed by their providers in the past. And so they come in hot, right? Because they're like, I know I'm not going to get what I want. So I'm just going to like really push extremely hard. And so sometimes like actually when they push, like giving them that space is the right thing to do. I think acknowledging, like, I want to hear everything that's on your mind. I unfortunately can't promise that we're going to solve everything today, but please do feel free to share everything, right? And so you've said up front, like, we're not going to solve all your problems, but I want to hear about all your problems, and just doing a lot of empathetic listening, a lot of reflective listening, and, you know, arranging for follow-up. That can be a successful visit. And with that third patient, if they were to read their list to you, I think it takes like 4 or 5 minutes. We've timed it before. So, you know, even if they just go for 5 minutes, that still leaves you 25 minutes of a visit to accomplish a few things. So I think those are some really, really great points, but really just like give yourself permission to work on rapport and establishing a relationship this month. You're not going to solve chronic disease tomorrow. You might start taking baby steps towards it, but people who are coming in with a lot of chronic illness that's longstanding, no one's expecting you to fix that tomorrow or the next week or this month, but just make those relationships. Great. Erica, who is in your group?
So we had Sefu, Jordan, and Alex.
Great. So what did you all see here or do that felt effective, productive, or that you want to try again?
We were discussing with the third patient about none of the lists, like none of the 11 points seemed to have any priority placed on them. And we were discussing what the benefit or value would be if we tried to negotiate with the patient to really effectively draw out what his or her priority would be of those 11, which were truly the most important to him, as a way of kind of negotiating and satisfying to a certain extent their needs, and being able to move the visit forward.
Great. That's great. Yeah. So really trying to get your patients to share some of their values and priorities if they haven't weighted any of the items on their list is great. And then there was one more group. Is that right? Yes. Last group. Tell me what you saw, heard, or experienced that was effective.
So again, everybody talks about this third patient, but I think there was a lot of learning in this case for everyone. Kim was the physician in this, and I think she did a really good job because the topics were not very clear. It was, you know, just kind of all over the place. I was the patient, and I was even confused on what I was reading. I was like, what's going on? But Kim did a really good job, you know, trying to make a list and then stating, you know, we're not going to get to all these today, but, you know, we definitely should keep a running list so we make sure that these are all talked about or addressed in the future. We did talk about maybe prior to agenda setting, stating, you know, I want to hear what's important to you, but could you tell me, like, as you're telling us this list, the first thing you should start with is, what's the most important thing that you want addressed today? So, you know, if your agenda setting lasts for 15 minutes, then at least some point you feel comfortable saying, we've got a lot to work here. Let's try to work with this to cut off to at least kind of continue the conversation in the visit.
Great. Yeah, so you can start agenda setting with what are the most important things on your mind today. You can say what are the most important 2 to 3 things on your mind. You can give them a number and really force people to prioritize in that way. And I like the idea of a running list. And honestly, I keep one on my notes. If there are unaddressed issues at the end of a visit, I write a note to myself, next visit, talk about, you know, mammograms or whatever. And just so that I can remember that when I'm reviewing for the next visit. Great. So in terms of observations, I really encourage you all to ask an attending, or if you have an R3 in your clinic who's observing, or a chief, to visit or to observe agenda setting on your first patient of the day, and for a couple of patients this week or next. And that way you get sort of signed off on agenda setting and can get feedback right away. The other skills that you will be getting signed off on, we'll talk a little bit more about later on in the block. But try to get your agenda setting observed. It's easy because it's the first thing that happens in the visit. And if you do it with the first patient, like, the timing is pretty easy. So try to reach out to people in that way. Okay. All right. So let's take a break until 10 o'clock.